Urinary tract infections, also known as bacterial cystitis, is a bacterial infection of the urinary bladder but might spread to other parts of the urinary system, like the ureters or the kidneys. Symptoms would include urgent need to urinate, even with the bladder not being full, pain or burning sensation with urination, and sometimes blood can be seen with the urine. The most common cause of cystitis is E. coli, which is a bacteria that lives in the gut and can come out of the anus while cleaning and then immigrate to the front and then causes the problem. There's also chlamydia, which is a sexually transmitted organism. Your doctor might prescribe antibiotics, but dietary approaches are very important in this case, and they are supposed to speed the healing and prevent the recurrence of the infection. So they are as important as the medical treatment. First off, you need to drink plenty of water. So 8 to 10 glasses a day will help your body flush out the infection material. Try cranberry and blueberry juice. These fruits contain substances that prevent bacteria from sticking to the bladder wall. Eat fruits and vegetables that are high in vitamin C, like oranges, tomatoes, broccoli, strawberry, green leafy vegetables. Also try probiotics like yogurt, which will help the growth of friendly bacteria, and that in its turn will inhibit the growth of the bad ones. So beyond the diet, you need to stop taking vaginal douches and use loose cotton underwear. Wash the genital area from front to back instead of back to front. Empty the bladder and drink water before and after having sex. Never use antibiotics without medical supervision, because you might develop resistant bacteria that will make the treatment even more difficult in the future. There is one exception. Some patients may have the same symptoms, but they have a different problem called interstitial cystitis, which is also called the painful bladder syndrome. This is a chronic problem where the bladder wall can become inflamed and irritated over long periods of time, so months or even years. This is a much more common problem in women than in men, and it might affect the quality of their lives very negatively. In this case, antibiotics will not help. Instead, you definitely need a food strategy, and here are some tips about it. So first, you should try something called an elimination diet. So you should have a food journal and try to link what you eat to the symptoms. When you notice that one type of food aggravates the symptoms, you should eliminate it from your diet. The main foods that cause this problem are coffee and spices, so you need to eliminate those first, and then other stuff as you might see it in your journal. Try going organic. Avoid processed foods with artificial sweeteners and flavors and preservatives and other additives. This will help a lot. Eat lots of fibers to prevent constipation, because this would worsen the condition when you have constipation. Unfortunately, in the case of interstitial cystitis, cranberry juice seems to not help much. In fact, natural UTI treatments can in fact make interstitial cystitis symptoms even worse. Instead, it's better to make a daily habit of drinking plenty of water, 8 to 10 glasses a day. All the best. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.